Logan. I'm Erica. I'm the nurse practitioner for Dr. Smith. I'm going to go ahead and do a comprehensive foot exam. We need to do this every year, okay? So I'm going to go ahead and look at your feet. Now when I do this, I want to look for any kind of lesions, any kind of ulcerations. Your skin color looks good. It's nice and pink. I also want to look for any distended veins that help indicate that you're having bad circulation. Everything looks good. I want to look in between the toes, and there's no cracks, no calluses, no lesions, no ulcerations. Your toenails look good. There's no thickness that can indicate fungus. I also want to check your pulses. So I'm going to check your posterior tibial and also your dorsal pedialis pulse, and you have +2 on both of them, so you have good circulation, so that's what I'm checking for. While I'm doing this, let me go ahead and check your musculoskeletal strength. So I want you to push against my hand, okay, and pull up, in, and out. Okay, and you came in here, you walked well. Any problems with walking or anything like that? No. Okay. Now it's important for you to do a foot exam every night. Try to find one time out of the day to always check your feet. You may have to use a mirror to look underneath your feet. You want to check in between your toes. You want to check for any kind of ingrown toenails, anything like that. Also, you want to check for any kind of neuropathy. That's when you have any decreased sensation in your feet, any numbness, tingling, pain, any sensitivity, like if it's sensitive to have sheets on your feet at night. Anything like that, any kind of ulcerations, anything that comes up, you need to be sure and get with us immediately, because we need to prevent any kind of problems coming up. So, what I'm going to go ahead and do now is I'm going to do what we call a monofilament test, and this just checks for neuropathy and checks your sensation on your feet. Sometimes diabetic patients lose a protective sensation in their feet, and so what happens is they can get a small sore that would normally hurt, and that would prompt you to look at it. Well, when people lose sensation in their feet, they don't know it's there. Who have diabetes may not know it's there, and so this small ulcer can end up being a major problem. So what I'm going to do is I'm going to do this monofilament test, and I want you to close your eyes and just say yes whenever you feel me touch you, okay? All right?
Yes. 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 Yes.
Okay. Do good. Now, I'm going to let you take one of these home. It's important for you to also, when you do your foot exam, to do this every night. So, and if you have any decreased sensation at all, you be sure and let us know. Okay? All right. Another test I'm going to do is I'm going to test your vibration sensory. So, this also checks for neuropathy. So I want you to close your eyes, and I want you to let me know when you do not feel this.
I don't feel it.
Okay, and I'm going to check. And I don't feel it either, so your sensation is good and intact. It's important for you to wear, just some education I want to give you, it's important for you to wash your feet good. Like I said, check daily your feet. You want to wash in between your toes, check in between your toes. You also want to moisturize your feet. Try to avoid putting any kind of moisturizer lotion in between your toes. When you take a bath, you want to be sure and check the water temperature with your elbow rather than stepping in, because the water could be too hot and it could burn your feet. And so then you could get burns on your feet, which could be, lead to potential complications. Also, you want to wear good fitting shoes. You always want to wear shoes around the house. Don't ever walk around barefooted. Definitely don't walk outside barefooted. As far as your shoes, you want them to be tight, form-fitting, kind of loose in the toes. You don't want to wear any shoes that will rub sores. You always want to wear socks. No high heels, which I don't think we have to worry about that. And I think that is about it. Do you have any questions?
No.
All right. Well, we will do a comprehensive foot exam every year, so we'll need to reschedule that. And if you have any problems, like I said, any kind of lesions or anything like that that comes up, any changes in sensation, then you need to be sure and contact us promptly. So, all right, Logan. I guess that's it.